word cancer used to, and probably still does, frighten a lot of people.
Had the lump been on my breast, I would have been really different.
John and Vanessa are just two of the many former sufferers from head and neck cancer who would have benefited immensely from earlier diagnosis of their condition, one of the aims of the Look Ahead Cancer campaign. Its chairman is head and neck consultant at the James Cook University Hospital, Middlesbrough, Mr. Richard White.
The Look Ahead Cancer campaign is a voluntary sector group established to try and promote awareness amongst the population of Teesside and the Tees Valley and its surrounds in County Durham in terms of early presentation, the symptoms that people should be looking for, to try and get head and neck cancer patients to present earlier to secondary care services.
The Look Ahead Cancer campaign, a voluntary sector group since January 2008, has obtained funding from local primary care trusts, generous private companies and charitable trusts to produce this training DVD for health professionals, who are ideally placed to raise awareness and advise about symptoms and risk factors. This DVD training package is primarily aimed at you, the person in general medical practice, and the wider healthcare community. Historically, the northeast of England, once the land of heavy industry and pollution of the environment where we work, hasn't always had the best of health records.
I'm sure that if we go back, and when I started practice going back in the early 1990s, we were seeing the end of a group of people where some aspects of their working lives had contributed. But what we've had is a consistency across that period and now where alcohol and smoking are key contributors to people developing particularly cancers in the head and neck, and those haven't really changed. And in fact, what's slightly more worrying now, we're probably seeing more and more young people who've got heavier smoking, heavier alcohol consumptions than in the past, and this has also changed in terms of the number of females who are smokers. And this means that we're seeing a slightly different distribution of people, but still the same problems, and on a national basis still rising slowly but steadily year on year.
As Richard White points out, despite the possible perceptions of the industrial heritage, there were and are other factors and behaviours definitely in play. Head and neck consultant Colin Edge points out how you can help to improve the situation.
In terms of the last 20 years, if you look at outcomes, how people's survival probably hasn't altered a huge amount. Head and neck cancer is still a big killer, and the main influence over whether people survive or don't survive is how early the cancers are spotted, how early they're detected, how quickly patients are referred to us once they present.
You may be surprised at how many people from all walks of life don't think that they can be even remotely at risk of contracting head or neck cancer.
I was a smoker, and I drank alcohol. I wouldn't have classed myself as a heavy smoker. In fact, I'm going to make a statement, and forgive me for sounding a little bit silly, but I would have probably classed myself as a social smoker. And at the time I just thought I was unlucky.
But where risk factors are concerned, luck barely comes into the equation.
Head and neck cancers, in the great scheme of things, are not common cancers, and in most of the country they form 2 or 3% of all cancers. Northeast of England, that rate's almost doubled, up to 5%, sometimes more than that. And so we do see more referrals with mouth cancers and generally head and neck cancers than, say, our colleagues in the south of England would per sort of 100,000 population. And we think that that may well be related to issues of lifestyle. The main risk factors for head and neck cancers are tobacco use, and in this country tobacco use is mainly in the form of smoking, and alcohol consumption. But we're really talking about the amount of alcohol that starts to affect your immune system, and that makes you more susceptible to having a cancer because your immune system doesn't field for that cancer and it doesn't remove it from the body.
But smoking tobacco isn't the only problem.
People in this country don't chew tobacco very much, and we've been saying in the past that head and neck cancers and mouth cancers have an incidence of possibly between 2 and 5% in this country, whereas in, say, the Indian subcontinent, mouth cancers might form 40% of all their cancers. And that's thought to be because they chew quite a number of noxious substances. They chew tobacco, they chew quid and pan and betel nut. And these things that are chewed and held in the cheeks all day that give you a sort of high, a lift, are also highly carcinogenic. So in the Indian subcontinent, there's a lot more oral cancer there. And in our minority populations in this country, if those social habits come as well, then they may be more susceptible to mouth cancers.
Where head and neck cancer is concerned, it's clear that some age and social groups are more at risk. But every adult is potentially and increasingly vulnerable.
I believe osteosarcoma isn't rare, but osteosarcoma in somebody at 34, I believe, from what I remember saying, that it's a young person's, sort of a child, teenage cancer, and an old person's cancer. I mean, and also I think where I had it was incredibly rare.
The cancers that we're dealing with in the mouth, in the head and neck in general, are both on the increase, and they are spreading from the older age groups into younger age groups.
So the evidence is clear. Age is no longer a yardstick, and gender matters not a jot. Smoking and drinking, binge and otherwise, are now crucial factors in the habits of potential candidates for head and neck cancers.